Hello, my name is Reuben Broome. I'm a medical oncologist. Our specialty has really been defined by the systemic or drug therapy treatment for breast cancer. Traditionally, for a number of decades, that's been considered chemotherapy, but we've also got a long-standing role in the use of hormone or endocrine therapy for breast cancer. Since the turn of the century, we've also been using targeted therapies for the treatment of breast cancer. So chemotherapy is really what we call cytotoxic therapy that preferentially kills fast-growing cells, which essentially what a cancer is. Chemotherapy is particularly good for high-grade or grade 3 cancers. Endocrine or hormonal therapy works either by blocking the production of estrogen or blocking the action of estrogen, and this is most effective for hormone-sensitive breast cancers, which we can get an understanding from based on what the pathologist tells us. Targeted therapies either block receptors overexpressed on tumour cells or protein function, growth factor pathways in tumours. Examples of that would be antibody drugs like trastuzumab or the neurodegeneration pertuzumab. We treat a lot of patients with early stage breast cancer, either after surgery or before surgery with drug therapies. In that situation, we are giving therapy with curative intent to try and prevent breast cancer coming back. Most patients, fortunately, following such therapy will be rendered free of disease. A small proportion of patients we treat for advanced cancer that has spread. In that situation, the main aim is to try and control the cancer. However, in some patients who respond well to drug therapy, even with advanced cancer, we are now pushing things and including other disciplines to try and render those patients disease-free and hopefully moving towards the ultimate aim of cure. Some of the commonly asked questions I have about breast cancer treatment are around whether or not patients can work whilst on chemotherapy after surgery. For most patients who wish to work, they can often manage to work for most but not all of the time while on such treatment. And that's in part because the supportive care therapies we use to try and ameliorate the side effects of those treatments. One of the other questions we commonly get asked is around when am I cleared to be free of cancer forever. Now, the 5-year rule is actually, the more we've understood about breast cancer in recent times, the more relevant the 5-year rule is for most patients with breast cancer. For instance, for triple negative breast cancer, their risk is in the first few years, and once they get to around 3 to 4 years, they're likely to be fine. For hormone-sensitive breast cancers, the risk is stretched over a much longer period of around 15 years. Those patients, there is a trend now to give longer duration hormonal endocrine therapy to try and keep those patients free of cancer. Thank you.